Okay, so just before I get into the next section, which is focus note 13 on page 342. I have a couple numbers written down here that you might want to write down. I don't think they're on that sheet. But this is the Alberta hotline,
Yeah,
which is 800-784-8344.
yep,
And the Canadian government hotline is 833-456-4566.
yep.
Okay, and you can call or text that line, either one. Oh, sorry, maybe just the federal one. Okay,
And the other one was the Alberta.
the first one was the Alberta hotline,
Oh,
suicide hotline. Okay, so looking at focus note 13 on page 342, it's just almost the same idea as that sheet, but it's just going through and saying, okay, are they willing to, are they willing to be referred is basically what it comes down to. So you encourage them to make the contact, and then second, if they agree, then good. If they don't agree, then suggest that you make the contact with them, and if they agree, that's great. If they don't, then say you will make the contact, but with them in tow, basically. Because in Canada, you can't really make a contact for a person. They have to be part of the conversation.
You can if you have their permission, and
Yeah,
Well, yeah, is that,
you can phone and have them on the line.
that's what I'm saying. They have to
Yeah.
be in tow. They have to be with you
Yeah.
in the room, shall we say. Okay, make the contact without the care receiver's permission. Yes, you can do that.
yeah, there's a reason for that,
Yes, it's around confidentiality.
yeah.
Yeah.
Well, aside from that, but they may be also not in the right mind,
Yeah,
you know?
true. If they're not in the right mind, just like our other situation we just described, they,
You would
you're-
call
you're-
911.
You call 911,
Yes, yeah,
okay. You can use this process for all three levels of suicide risk with the contact mentioned in the flow chart, varying for each level. In a case of a care receiver who's at full high risk, for example, the contact would be the emergency services followed by our crisis contacts. For a care receiver at low or moderate risk, your first contact should be the crisis contacts. So, focus note 14, 15, and 16.
So you said for the low, the first contact would be what?
For low or medium, you're gonna let your crisis contacts, i.e. Linda and I,
Oh,
in on the secret,
yeah. Right.
okay, just so that,
That would be after the meeting.
right, and then we together, make a decision, okay, is this something we need to push a little more? Or maybe it needs to be referred to the pastor, or maybe, maybe there's other aspects of this that need to be referred to somebody like LL or
Right.
somebody who's gonna look at it from a more spiritual
Maybe
point of view.
others have to assess the person too.
Mhm.
Yeah.
Okay,
And then for high,
higher risk, you're not gonna take that time, you're just gonna make the referral.
Irregardless of what level they are probably going to need to be connected to a professional service,
yeah.
which happens through the family doctor or the walk-in clinic in the moderate or low,
In the
and not
Ontario
and
context,
an
or in the
emergency for high.
Alberta context, yes.
Yeah, so you wouldn't. Anyway, that's fine. I'll just leave it at that.
So focus note 14 on page 343. Steps to take if suicide risk is high. Get help from emergency services immediately. Stay with your care receiver, or if you're on the phone, keep him or her on the phone line until professional help has arrived.
So you're understanding that one. If you're on the phone with them, hopefully there's somebody else around that you can hand a note to
Right.
and say, call 911, go to this address. That's what they do, like when I worked for public health, we got them sometimes. We got people calling in and we would hand the note off, someone would call 911, and then we would stay on the phone with them until the help got there.
If you're with a care receiver in person, call emergency services and tell them that you're with a person who intends to die by suicide and that you need help getting him or her to a safe place. If you're talking with your care receiver on the phone, keep the care receiver on the phone and have someone else call emergency services if necessary. Find the nearest person, whether a neighbor, a coworker, or anyone else, to help you. After calling emergency services, call your Stephen Ministry crisis contacts, briefly explain the situation, say that you need someone to come immediately to help you with the care receiver. If possible, once emergency services arrive, either go with your care receiver as well or have someone else do so. If you believe your care receiver poses a threat to anyone in his or her presence, keep yourself safe and rely on law enforcement to help the person. Don't stay in a dangerous situation. Okay, Lauren, can you read through focus note 15 at the bottom of the page there?
Steps to take if the suicide risk is moderate. Help your care receiver make a commitment to get professional care. Do not leave your care receiver or hang up the phone until he or she has made that commitment. And you have communicated that you will be working with your crisis contacts to connect your care receiver with a mental health professional. Talk to your crisis contacts as soon as possible after speaking to your care receiver. If you need your pastors or Stephen leaders' assistance in helping your care receiver, agree to obtain professional care. Ask him or her to meet with you and your care receiver right away. Check back with your care receiver later that day or if necessary the next day. Continue checking in regularly until he or she begins receiving professional care, as well as afterward if appropriate.
So this is pretty clear in here, right?
Yeah.
Your little sticky note with the red flag could go right there, right?
Okay, focus note 16 on 344. Steps to take if the suicide risk is low. Harold, can you read that one through?
Okay, so steps to take for suicide or low risk. Have your care receiver commit to take with you, to talk with you, your pastor, trusted family member, or a suicide prevention hotline if you begin to feel suicidal. Don't leave or hang up until they agree. Talk with your care receiver about receiving care from a mental health professional. Take your crisis contacts, talk to your crisis contacts after you visit about getting the care receiver connected with professional care. Until your care receiver begins receiving professional care, be sure to talk with them about their thoughts about suicide, during which regularly scheduled caring visits. It's also a good idea to check with your care receiver briefly by phone in between caring visits. In general, continue to stay alert and additional signs of suicidal ideation in your care receiver in case their level of suicide risk increases.
Mm-hmm. Okay, and actually there's in focus note 17 there is actually the same things I was just talking about previously. I guess I kind of jumped the gun. The suicide prevention hotlines, and what it doesn't mention there is also the 811 health line and the 911 emergency services. Okay, so we're going to start the skill practice on page 345. Okay, first.
Are we gonna talk through this because we're such a small group?
Yes.
Okay.
First, spend 3 minutes preparing. Steve administers your description of the skill practice is on page 345. Read only your focus note. Then after you've read your situation description, Review focus note 8 on page 340, which lists every step to take if you believe someone's got suicidal thoughts. Care receiver, so stick your finger in page 340 basically is what that amounts to. Care receivers, read your description of skill practice in focus note 19.
So, number 18 is the Stephen
Is
Minister?
Stephen Minister. And
Oh,
19
okay.
is the care receiver.
Okay,
Okay.
so do you want us to stop and read this, or do you,
Well, why don't we do?
or do you just want to read it?
You get me reading as less as you necessarily can.
Okay,
Right.
I'll read it.
Well, in just a minute.
Yes.
Why don't, Linda, why don't you be the Stephen Minister
Okay,
in 18? And Lauren, why don't you be the care receiver?
okay, I have to stop it then to read it.
Otherwise-
No, just let it go. Keep going.
Then I have to read it out loud.
Yes.
Okay. Stephen Minister's situation description for skill practice 1. You've been caring for your care receiver for several months as they recover from hip surgery. Your care receiver has just found out that they are in the early stages of Alzheimer's. You are visiting a couple of days after they received the diagnosis. The care receiver will begin the skill practice. Okay.
So you got your finger stuck in page
Oh
340.
boy, you're really putting me on the spot. So,
Okay.
who's gonna be the care receiver?
Lauren.
Lauren, so
So,
Lauren will read that.
Do you want me to read this? You have been meeting with your Stephen Minister for several months while you recover from hip surgery. You've been recovering well, but a few days ago you learned that you are in the early stages of Alzheimer's. Your physician has told you that some medications can lessen symptoms for a time, but indicated that it's time for you and your family to begin making plans for the future. The diagnosis has left you shocked, frightened, and overwhelmed. You found yourself thinking it might be better to just go ahead and kill yourself and not put yourself and your family through years of dealing with your Alzheimer's. You don't want your family to have to bear the burden of caring for you and watching you degenerate over the coming years, and you don't want to have to endure the humiliation of experiencing it. Although you aren't sure you have the courage to kill yourself, you aren't sure you have the courage to go through this disease either.
Keep
Is
going.
the next,
Okay.
oh, keep going on the next page?
Yep.
The thought of suicide frightens you almost as much as Alzheimer's does. You don't have any plans to end your life at this time, but you've been surprised and scared by how much thoughts of suicide have occupied your mind since you received the diagnosis. You want to talk to your Stephen Minister about these thoughts and feelings. You are meeting with your Stephen Minister a couple of days after receiving the news about your diagnosis.
Okay,
Begin the skill practice by saying, I'm so scared that I can't think straight. Then tell your Stephen Minister about your Alzheimer's diagnosis, your worries about your family having to take care of you, and finally your thoughts about suicide. If your Stephen Minister suggests that you get help for your suicidal thoughts, resist the suggestion at first by saying it is unnecessary, but eventually give in and agree.
Okay.
so what is the focus note that I'm supposed to be looking at? The 6 steps?
The one that you read through and then page 340. Yeah.
Oh, 340 is my reference for
Right.
what I'm gonna do.
Right.
Okay.
So you're going to talk to.
Hey Lauren, how's it going? I haven't seen you for a week.
I'm actually really scared of this time.
Oh really? What's going on?
Well, I've been diagnosed with Alzheimer's, early stage.
Oh my,
And,
I'm so sorry to hear that.
yeah, and just
That must be a bit of a shock.
a bit of a shock and just kind of lose my desire to live, actually.
Oh wow. I don't think that's all that unusual for having that kind of a diagnosis. I think
Yeah,
anyone who gets that kind of news is probably gonna react that way.
Yeah, like my family, they're gonna have a hard time with me, and
Yeah,
I'm gonna have a hard time, so
Humiliating experience.
it's humiliating, yeah.
yeah. Have you said you were thinking that maybe it would be better if you weren't living.
Yeah, that thought just occurred to me a few times.
Have you ever had any, thoughts about how you might end your life?
Well, no, I've never really thought about it
Okay,
until this came up.
okay. It sounds like you're finding this kind of scary to be thinking this way.
Yeah, I mean, the Alzheimer's is scary, but taking my life is scary also.
Yeah. Well, Lauren, what we usually recommend when people are in that kind of a situation is to connect with a mental health professional. And the first step is probably talking to your family doctor and, trying to link you to some support. Also, there happens to be a good resource here in central Alberta. There's the Alzheimer's Society, and we have one of the members of our church, her name's Lori Orange, and she might be a good person for me to connect with because they have a group, a support group, and there's actually a nurse who I think she's connected to public health or home care or something like that, and this is her area of expertise. So they might be able to have some ideas for you about how, you'd be able to talk to them, and they've seen lots of people go through this. They might have some ideas and some support that might help you out. Do you think you might be interested in any of those?
Yeah, that sounds good.
You're supposed to be resistant.
Yeah, actually,
So, like, if you were resisting, I would just say, you know what? I don't want to see you go down a bad spiral. It might be a good idea just to talk to your family doctor, and maybe your wife would,
Yeah.
could go with
I
you.
was thinking, like, if I was really feeling depressed or like
Mm-hmm.
nothing is gonna change this, right?
That's right.
That could be really hard
Yeah.
to accept anyhow.
Yeah, that's like you're gonna, those feelings you're going through. Like everybody who's had this diagnosis goes kind of through that. And that's why the Alzheimer's Society is a good link,
Yeah.
because they can help you and your wife walk
Yeah.
through this
Yeah, right.
and give you, some good ideas on how to cope with this.
Yeah.
Not to mention, this
They're
is
pretty busy.
not part of the Stephen Minister's role, but
Yeah.
I heard on the radio that they've got a new Alzheimer's drug, and it looks really promising. So, might be good to check with your family
Yeah,
doctor.
for sure.
Okay, so how did she do?
She did well.
Did well, yeah, okay.
Are you gonna,
Sorry?
did I ask him if he had any thoughts about how he might, I think I did,
I
right?
did, yeah.
Yeah, she walked through that.
Yeah.
So I haven't really thought about it.
Asked was the Stephen minister's response appropriate for the level of risk, which it seemed to be.
I think he's moderate, low moderate.
Mm-hmm.
Do you guys, where
Yeah.
would you rest with that?
I'd say it was.
Like I would, if we're going on this, sorry, it's late in my mind and my tongue are not connecting. If we're erring on the side of caution, we would say moderate, right? We always go to err on the side of caution.
Okay.
So I didn't even look at the list to see if I did all those steps, so.
So Stephen Minister, would you do anything different if you were to do that over again?
If I was to do it over again, I think I could say to him, I'm concerned about you and I don't want anything bad to happen to you. And I think that your life is worth living, even if there's, bad news ahead. Like nobody really knows how fast things are gonna go down.
Yeah.
And there is some, I probably would even say it, like we're not supposed to give medical advice, but definitely, I think, talking to the family doctor and, you know,
Yeah.
the Alzheimer's Society, so I would do that, but I might have said, I don't want anything bad to happen to you, I care about you.
Yeah.
So
That's cool.
can we stay in touch? If you really get thoughts, like you really have an idea of what you want to do and you're ready to do it, please call me or call the suicide hotline. Go to Emerge, go to the walk-in, any or all of the above, I guess.
Yeah. That's good.
Okay, let's skip to page 349, skill practice 3. So skill practice 2 was about a single parent and not coping with being a single parent after their spouse died 2.5 years ago. Number 3 is about a person who has arthritis and loses a family member. So at the same time. So, Harold, why don't you and I do this one? So why don't you be the Stephen minister,
Okay.
and I'll be the care receiver. So if you want to read over the note on page 348,
Okay.
focus note 23. You don't have to read it out loud. Read it to yourself.
Oh, okay.
Everybody else can read the note too. You suffered from, and then I'll be the care receiver. So hi Harold, I just phoned to let you know that we've had a big accident in our family, and my daughter and our grandchildren have been killed in a car accident.
Oh, my.
And I just can't imagine living without them, because I just had so much that I've had to depend on them. And I don't know what to do. I don't know where to go or how to get help or whatever. So I think it's just better if I die too. So I called to thank you for your care and say goodbye.
Oh. And what's your name again?
Byron,
Oh, okay,
No,
you're really
we're
Byron.
past the Alzheimer's one.
Byron, I'm really distressed with this conversation. Are you all right?
Like I said, I just don't know what I'm going to do. I have nobody to look after me in the way that she has looked after me. And I almost wonder if it's my fault that she had the accident, because she was on her way to my house. And so there's a lot of things going on here.
Yes, of course, and that's normal to think that way. Do you have somebody with you right now? Is there somebody at home?
No, I'm by myself.
You're by yourself?
Mhm.
Would you like me to come over? I'm
Uh,
only 5 minutes away.
Well,
and I'll stay with you on the phone on my way over.
Yeah.
I'm not hanging
I
up.
would do that too, yeah.
okay.
Sounds like you need
It's
some
a date.
help though.
Yeah.
A little concerned about you.
Yeah, oh, I appreciate that. Yeah, if you have some thoughts, that would be wonderful to hear, but I don't know. It's like I say, it has left me feeling kind of helpless.
Yes, that's understandable. Have you talked to your doctor?
Haven't really talked to anybody. You were my first call.
Oh, okay. So.
So you're on your way over.
Yeah,
You're not gonna let him off the phone.
are you, yes,
Let's say you just come in the house.
okay.
You're now there.
Yeah, okay, are we gonna hang up now, Byron?
No, you're not,
Talk.
because you're there. Okay, got it.
I won't be able to afford my cell phone bill next month.
Oh my God, what are you doing with the rope?
Just measuring out the coffin.
Oh,
I don't know, I can't remember where to go with it.
okay,
Can you
so,
think of anything?
hey, Harold, he's high risk. What are we, where's the sheet?
He's high risk, so
Oh, here it is.
we have the sleeping pills ready.
Okay, you got this?
Yeah, you
You're
don't,
gonna
you don't want to take those. You don't want to take those pills. They'll give you
You're
heartburn.
gonna,
Yeah.
going to say to him? I think we need to call 911.
Okay, I
See
think
where
we
that
need
takes you.
Byron,
Yes,
I'm concerned, my friend,
okay.
with your state of mind. And I think you probably have some concern about that yourself. I think we should really dial 911 right away and get some help over here. What do you think?
Well, I don't know if you want me to think about it, but yeah,
Well,
No, he does need your permission,
he
right?
does need permission. Okay, I guess I'll let you do that.
yeah, okay, 911, could you get over here? I forget the name of the address, but come on over anyway.
What's the
Name's Byron.
situation? Why are you calling?
Byron, we have a distressed individual here. He's probably around 35.
I think he's 65, but
Pardon?
He's had
he's
arthritis for
65.
years.
He's had arthritis for 30 years.
Yeah,
What's the issue, sir?
His
What can
daughter's
we
got
help you
children.
with?
I'm not sure, I don't think he's taken any have you taken any medication?
Yeah, I'm take medication for heartburn and stomach.
Sir, why are you calling 911? What's your concern?
My friend Byron, his daughter's been in a serious accident.
Oh,
and
okay,
I believe she died.
okay,
Yep.
The family died with her.
yeah. Are-
And so, I mean, he's in serious mental distress.
Well, do you think he might try to harm himself?
I'm feeling that, but I don't know for sure. We
Okay,
need some
well,
help.
you know what? It sounds like we should send the ambulance over there.
That'd be a good idea.
Do you think he might hurt you or anybody else?
No.
Okay, so an ambulance is
Yeah,
probably appropriate.
Do you have any support, like mental, like a psychologist type person, or?
Well, usually
Nurse?
if someone is at risk like this, we usually take them to Emerge,
Yeah.
and then they'll connect them with what they need. So
Well-
are you willing to go along with, so do you have your friend's permission to contact us?
Byron, is it okay if I contact him?
Yes.
Yeah.
Okay.
Yeah, he's okay with
Okay,
that.
okay, all right, that's great. So we're sending somebody, and you're gonna stay with them?
Yes, I will.
And are you willing to go to the hospital?
I am, I
Okay.
will go to the hospital.
Okay,
as well.
all right. Paige?
Now, that's good.
350.
Very nice.
Okay. Okay, so how do we show compassionate?
Empathy, empathetic.
Mm-hmm.
Validation.
I like the saying, but by the grace of God go I. Maybe if I was in that person's situation, I would be reacting the same way.
That's good.
So that to me is compassion,
Mm-hmm.
to put yourself
Yeah,
in the other person's shoes.
of course, yeah.
I had here no judgment and being bold, persistent.
That's interesting, eh? Being compassionate sometimes means being
No.
bold, not being timid, right?
Mm-hmm.
Patience.
Mm-hmm.
Okay, full of faith?
No
Prayers.
condemnation.
I put down prayers.
No condemnation.
So where would you see prayers applying?
What's
Like,
that?
where would you see a prayer applying here? Like on your way into a situation or,
Well, yeah, all,
'Cause
any step in that.
yeah.
Pray
Because
for me, that I
often a
can
person,
support.
I wouldn't think, if they're getting prepared to kill themselves, they're not really in a mood to pray,
Well,
per
then
se.
you could offer.
You could offer, that's true.
Well-
Okay,
Yeah.
Oh,
It
boy.
might not come to your mind, right?
leave it going. Giving hope.
Yeah.
So the word,
Yes,
giving,
giving hope.
giving hope, we're giving positive, giving hope, we're here for you,
You're not
you're
alone.
not alone.
Well, then that
I
brings
care about you.
evangelism as well, then, eh?
Yep,
Mhm.
Oh, yeah, within margins, yeah. Yeah, we don't wanna hit them over the head with a Bible when they're already on the way out.
Well, maybe.
Okay, skilled,
Active listener.
Knowing the 6 steps, or at least knowing where to look for the 6 steps, right?
And those were page
Uh,
340, wasn't
yes. Page
Um,
340.
it? Yeah.
So what was that steps thing called?
They're the questions to ask.
6 steps for responding.
Responding to a care receiver who may be considering suicide. Focus note 8.
I had knowing your resources.
Pardon me?
Skill, knowing your resources.
Yes.
And that means knowing when you need to call for help too.
Yeah.
You call your crisis contacts. Now, that might be a little hard if you're on the phone with somebody.
Yeah.
Well, it's body language.
Yeah.
Yeah,
Knowing how to read them.
Life's experiences.
Yeah, I had that put it a different way, but the same idea, trusting your gut.
Yeah. Yep.
Just,
yeah, that intuitiveness that God has given you,
mhm.
that, you know, you're trusting Holy Spirit
Yeah.
to, maybe that's more full of faith, I don't know, but,
Okay.
Mm.
Trustworthiness.
Always confidentiality. Always.
Yeah.
except if you're in danger, or they're in danger, am I right on that?
Oh, yeah.
Yes.
If someone is homicidal, we don't worry about the confidentiality, right? If they get violent, like when our daughter got violent,
Yeah.
they had to form her. So at that point, the confidentiality went out the
Or
window.
if they refuse to.
Yeah,
get-
because it's
get
things you
help.
have to do.
Right, right. So that, like, knowing that, if they're not in their right mind,
Yeah.
that confidentiality may not.
I'm not sure
Apply.
assessment of that though, right? Yeah, so you have to be careful.
If you're not sure, then you call your crisis contacts,
Correct.
right?
Yeah.
I'm
just
not sure
number 4 here,
what
it
to
says
do.
It's been widened out, the circle of confidentiality.
Okay.
Well, they may say no to 911, but you may still call 911.
Yeah.
Maybe
Yeah.
that's what I'm thinking.
Yeah.
Okay. I think we're done.
Okay,